name is Trina Simiola, and I'm with Premier Benefit Consultants. Today I'm going to teach you folks a little bit about Medicare and your Medicare choices. Okay. My name again is Trina, and I'm native Hawaiian. I grew up in Papakale Homestead. I graduated from Roosevelt. I have 3 girls, 12, 8, and 4. I've always had a passion to help Native Hawaiians in the community. And so I finally found my niche, and it's a great resource. I can be a great resource to you folks and being able to help you provide that service. Premier Benefit Consultant is a brokerage company that is contracted with many different health insurance plans, okay? We offer an honest and diverse knowledge, which means that we don't just represent one plan. We represent the major plans in the state of Hawaii. So we can give you a better overview of what is out there and fit you with the best plan for you. I know a lot of you folks may think that this information may not apply to you, but I would like you to think of, you know, a few people that you have in your family, like your friends, your family, grandparents, parents, aunts, uncles. One of the hardest things about my job is not being able to tell people. So if I was to see you on the street, I couldn't be like, "Oh, Auntie, do you have all your Medicare choices taken care of?" I can't do something like that. They have to approach me. And so that's very rare that anybody would think I help people with Medicare benefits, right? So that's one of the hardest things about my job. So I would like to ask you folks for help to pull out a piece of paper, write down people you know that are age 65, those are disabled, and you're not going to give this to me, it's just for your knowledge so you can see how many people you can help and impact in your life with the information I'm going to share with you today. Okay, so write down, you know, neighbors, aunts, uncles, grandparents, parents, cousins. Now this is also those that are disabled, so sometimes they're young as well. Again, I'm not going to ask for this, it's just for you to have the information for yourself. Okay, whether to pay for, oh, I don't know how to do this. Well, one of the hardest things that seniors face daily is whether to pay for their prescriptions or to pay for their hot meal. And I want you folks to know that there is choices out there that you folks don't have to have your loved ones make these tough decisions, and you don't have to have the burden to carry them throughout their life. So again, you know, if you could write down your family, friends, names, and all that, and then I'll go ahead into our services. So Medicare is a federally funded program. It's run through a program called CMS, the Center for Medicare Services. Who qualifies? You must be a U.S. citizen, must be age 65, or meet certain disability. You must work 40 quarters in the United States, which is about an average of 10 years, then you can qualify. Or you may have end-stage renal disease, which is the kidney failure. Medicare is broken up into different parts that cover different benefits. So it's very different from your employer's benefits. So everything is sectioned off, so not all your benefits is wrapped into one. So Medicare Part. Medicare Part A covers hospital, which is only inpatient, not emergency room. Home health, hospice. Medicare is normally given for free to those that work 40 quarters. Part B is where your doctor visits, emergency room, lab services, DME services, and this benefit is about an average of $100 per month taken out of your Social Security check. Now, what about the prescriptions? There's something called Medicare Part B, which is the prescription coverage. It's normally run by private insurance companies like AARP, Prescription Scripts, and so on. Medicare Part B, there's normally a monthly premium for these that these private insurance companies offer. They run about $16 to $30 a month. And some plans also have a deductible that must be met first before the plan covers you. So that's more money out of your pocket. So we talked about Medicare Part. Medicare Part A is inpatient hospital services. Medicare Part B is your doctor visits, labs, DMEs. I spelled that wrong. And Medicare Part D is your prescriptions. Medicare A and B is typically only covers 80%. And the member is responsible for 20%. So now, 20% of a hospital inpatient stay of a $100,000 bill, that's about $20,000 that is the member's co-share. Now, how many of you, with the list of people you wrote, know who can pay for that? I know a lot of them cannot. They're living on fixed incomes, and this is very hard. So we talked about Medicare A, B, and D. Now we skipped one alphabet, Medicare Part C. That's a Medicare Advantage plans. Medicare Advantage plans are run by private insurance companies like HMSA, Wahine, United Healthcare, Humana, and etc. Most of these plans have a zero premium monthly plan. There's no deductible. Now, how do you qualify for a Medicare Advantage plan? You must be part of Medicare A and B. And if you are paying for Part B, you must continue to pay your Part B premium. Why choose a Medicare Advantage plan? It covers the same benefits original Medicare does, and it protects you with something that's called the maximum out-of-pocket, or the MOOP. Maximum out-of-pocket, it will limit the member's maximum out-of-pocket for a year time. So if someone gets hospitalized, now original Medicare only would cover the 80%, member would be 20. Now with the maximum out-of-pocket, there's plans that their max is $3,500. Now which is easier to pay for, $3,500 or $20,000? $3,500. And so it gives them the maximum out-of-pocket, protecting them from that catastrophic incident of happening, and then also giving them fixed co-payments throughout the year. Now, if they reach the maximum out-of-pocket and they have, like, say, 6 more months within the year, they don't pay for any other medical services because they already reached their max. So it's like a protection. That's what it's for. Okay.
And there's no premium for that?
No, a lot of times the Medicare Advantage plans, there is no premium. So they just maintain their Part B premium, yeah? That's it. So Medicare Advantage plans also have plans that include prescription drugs, so there's no cost for it. So you can eliminate the prescription drug monthly premium. You can eliminate premium for the plan total. And then now, you no longer have to pay a separate monthly fee for it. So you're saving that $16 to $30 a month, having all the benefits run through one plan.
Do they have a maximum total amount that you can spend per month? As you go over, you have to pay that difference?
As to the prescription?
Prescription, yeah.
No. No. There is a different requirement for prescription drug coverage. It's called the catastrophic drug coverage, and every plan has it. Yeah, it's separate. Yeah. So for a Medicare Advantage plan, this helps protect the member from a catastrophic loss. It also provides them with prescription drugs, as well as their hospital and doctor visits, all run by one plan, making it easier for the member. Also, Medicare Advantage plans also can offer extra benefits. Some of those extra benefits are eye coverage or exams. Original Medicare doesn't offer that. Original Medicare doesn't offer hearing benefits either. These things that, 65 and older, or those that are disabled, we have to do on a yearly basis. And so if you just have original Medicare, you're paying full out of pocket. So with Medicare Advantage plans, they have these benefits included. And some are also catalog ordering, like over-the-counter things like Advil, Tylenol, toothbrush, toothpaste, vitamins. They can order from this catalog an allotted amount of allowance, and it gets delivered to them at no cost. There's also gym memberships that's included into plans as well. There's also transportation, and then there's also dental. So plans offer different extra benefits. The only way to see which one you qualify for or which plan is best for you is to sit down with an agent and find out which one best fits. Medicare Advantage plans offer the same benefits that original Medicare does, but it also offers the extra benefits. Just to recap, giving the member more protection, more predictable co-payments, providing a protection in a catastrophic loss. Medicare Advantage plans offer all the benefits you need with one company, making it easy to manage, and and costs for Medicare Advantage plans are zero. Okay. Now, with the list of names you made, can you help or share this information with any of them that you have made the list of? You know? Now, again, my time, my effort, my resource is free. It's no cost, no charge, no obligation. So again, my hardest thing about my job is getting in front of them and getting the information that they need to know. So a lot of people ask me, what is the best plan out there? And my question is always, there isn't the best plan, but there is the right plan for you. So let me help you decide which plan is best for you. And again, my name is Trina Simeona with Premier Benefit Consultant. My number is 356-9300. I also have business cards here as well if you'd like some. Yeah. And do you folks have any questions? I know some of you came in. You're welcome.
You know, I came in late. And
Yes.
Did you go over the Advantage plan as well as the others?
I did. I went over the overview of what a Medicare Advantage plan is. I didn't go in specific to what plan, into a plan, because I represent many, and I cannot share plan specifics unless I have a one-on-one appointment. Then we can discuss more plan specifics, yeah? Because, you know, we are mandated by the federal government, so there is a lot of rules and restrictions, and so don't want to entice people or, you know, like lure them in with the benefits that some plans have. And so what I do is ask a series of questions as to what is your concerns, what are the benefits you're looking for, are you looking for a PPO or HMO? You know, there's a difference. HMO is a health maintenance organization, which means it's a closed-off organization of doctors that's contracted. PPO is you have a flexibility. You can see in-network and out-of-network doctors. So it just depends what category you fit in and what's your concerns.
Now, Medicare itself, there are several programs. There's a Plan A, B, and
Yes.
B, I think.
Yeah.
What are the difference between them?
Okay, so Plan A, I'll go back.
Thank you, I'm sorry.
No problem. So Plan A covers hospital, inpatient, home health, hospice. This is all it covers. And Medicare Part A is only given to those that work 40 quarters in the United States. That is given to you for free. Part B is something you pay for. But this Part B is what covers your doctors, your emergency room, DME, lab services. And this runs about $100 right now this year.
So everybody pays for that?
Everybody pays for that. There is programs, though, that can help you pay for that. Through the federal government, through the state. There is programs. Yeah.
So there's nothing that when you turn age 65 that and you go on Social Security, there's nothing like free. Like, I mean, I'm not talking
Just
like,
the A.
just the
Yeah,
age,
if they work the 40 quarters, just the A is given to them for free.
that's free. So
Yeah.
okay, so the A is free if you have to go to the hospital. You say I have Medicare.
Right.
Okay, and no, everybody has to take you no matter what because you have Medicare.
No, not necessarily. People are contracted to the fee schedule that Medicare abides by. And so there is still, not everybody takes it.
Not everybody takes it.
Right. But hospitals here in Hawaii, a lot of them take it. Yeah.
So you can go there and then, but it's not covering, it's covering your hospital stay,
Only if you're admitted. Yeah.
only if you're admitted. So it doesn't cover the cost of, you checked into the ER and you saw the doctor and then the doctor.
Correct. That's why Part B, that's why I said, you know, Medicare, it separates all your benefits. It makes it very hard, very confusing. This doesn't even cover vision or hearing. It doesn't cover any of those. So all those preventive services are not in here.
Okay.
Yeah.
Where are they? I see.
They are through different programs like Medicare Advantage plans. Yeah.
Okay, so, like I know if you work city and county and you were there for a certain number of years before they changed their plan and all of that, you're like grandfathered into this fabulous medical coverage,
Yes.
right? Some of us are in the private industry, so, you know, I think we get like a stipend or something for our medical. So your services would enable us at that age to come to see you and tell you that this is what I got for my retirement, and
Yes, and we can defer whether you want to choose what your retirement benefits offer or go on your own through the Medicare Advantage plans.
so
Because through state, people that are grandfathered in, we never change them because they can never get back into their
right,
original plan.
and they have a family.
And they have a great plan, exactly. Some federals, also, we do not touch. So we do know our restrictions and we don't want to jeopardize a member's hardship as far as, all the years you worked, you earned it.
Private entities, other than the state, city, and county, and federal, a lot of them, when you retire, unless you're working for a fabulous company, medical is not, I mean, you get maybe a COBRA allowance, right, or something, right?
Not even that, because COBRA only allows you 18 months.
Oh.
And it's a ridiculous amount too, COBRA.
Yeah,
And
it is.
it's not even really that great of a plan after. Yeah,
That comes out of your pocket to pay Cobra.
correct.
It's like $250.
So
If you're lucky.
Yeah, way more.
Yeah.
Yes.
So is the Medicare, so the Medicare Area A is free as long as you work those
40
quarters.
Yeah.
The Medicare B is the additional where you would determine what you need and you would pay a premium for.
Correct.
The-
And if you do not choose the Part B and you do not choose a Part D or a plan that has a Part D, you get penalized.
How?
You get penalized by the federal government, a percentage from the day you were able to enroll all the way to the day you do enroll. So some people never even have Part B for
How do you
years.
get penalized?
The federal government,
But how?
they penalize you.
No, but how do
So
they-
out of your social security?
Yes.
Oh, okay, okay.
Yeah, yeah.
So,
So you're penalized for not enrolling in Part B.
Correct. And also Part
So
D.
why does it become an option and not mandatory?
Well, because some plans or some people have, a retirement benefit that they don't need it, so they'll just take the A for free and then they'll not opt to take the B or the D because then that's additional cost for them and they don't need it, so that's why it becomes a choice. But for a lot, like 90% of us, we do have to make that choice and we have to make a wise choice because you only have 3 months before your birthday month, and 3 months after to make that selection. Once that's done, that window, you will get penalized.
And that's when you're 65.
Correct.
Yeah. So what is Part D?
Part D is your prescription drug coverage. And it normally runs by a private insurance company and they normally charge you a premium between $60 to $30. And then some of those plans have a deductible you have to meet first before they cover you.
Is that all covered in the Medicare Advantage?
Yes. Medicare Advantage plans cover everything, your hospital, your doctors, your prescription, and then the plan itself doesn't cost anything. But if you're paying for Part B, you must maintain that $100 monthly premium, which you're gonna do anyway, whether you go at original Medicare or if you go through an Advantage plan.
And the Advantage is free.
And the Advantage is free.
is that Medicare B $100 a month premium, is that based on what your income or anything like that? Is there qualifications? Is there a various of premiums that you
Yes.
could pay for Medicare B and how is that determined?
By the year that you turn 65. So some that had turned 65 prior, they pay like 96, 97.
And who
it just-
determines that fee, the
The
federal government?
government, yeah.
Oh.
So it changes, every year it changes, every year, when you're getting closer to that age, that 65, the Medicare and You book comes out, letting you know the new fees, the new programs, what each plan rates in your area, what they cover, what's the average cost, it goes through all that, but it's very foreign language, it's not easy read, it's not easy to understand, so that's why it's very participative.
It's not even interesting.
No, it's not. It's boring. It's boring.
Really boring.
It's very boring. You want to know cutthroat. What do I have to do?
Just, yeah.
What is
You know,
important? What do I need?
Bullet point.
Yeah, exactly. Yeah. So Medicare Advantage plan does cover everything, and then it also offers extra benefits: the vision, the
The
hearing.
Advantage plan.
Correct.
So if you were doing this all on your own, without someone like you, which I imagine that a lot of our seniors that are, you know, going through that
Correct.
route are doing that because they don't know that you have services like this.
And then a lot of times they try and turn to their children, but they don't know anything either.
So if you, so say, you know, oh, okay, I know, I gotta get the Medicare B. You call, you know, you choose your carrier that you're gonna pay your premium to and all that. They're not gonna tell you about the Advantage plan.
No, what you're gonna do is get all this junk mail from all these plans, and then you're gonna be even more confused. Like, oh, which one do I go with now? Because this one's saying this one's saying this. You know, they're all promoting different things, but you don't know which one is right for you. You know.
But they have embedded in all of that, they'll have this free Medicare Advantage plan, hoping that you won't take it.
Actually, I think they're hoping you do take it because it eliminates the government from taking care of your medical costs. If you look at it, because they cover 80%, that's quite a bit. These companies, these other companies, they have a variety of books. I mean, they run private insurance, they run group insurance, they run Medicare. You know, so they have a wide variety that they don't have to just rely on Medicare members. You know. So if something happens to a Medicare member, it's kind of balanced out. If a catastrophic loss was to happen, you know, like a $20,000 bill or whatever, you know, it's balanced between the rest of the books.
So if you choose, say I'm with HMSA, and I choose the Medicare B and I pay my premium, and then I you know, I tell them, okay, I want that Advantage plan.
Yep.
They'll cover me. Who actually pays them? The federal government?
The federal government pays these plans a monthly premium for your enrollment.
But the federal government it's not gonna go out there and tell you choose this Advantage plan.
Correct, they cannot. They cannot. That's steering you to choose these plans, but they do.
Even though that's the plan.
Yes, but again, not for everybody, yeah? Not for everybody.
How is the Obama, you know, I'm really kind of ignorant about politics and stuff like that, but, you know, his healthcare initiative, how is that affecting this?
As of right now, it's not affecting the Medicare Advantage plans, but again, you know, I don't know what will happen in November.
So no benefits have actually come out of his whole healthcare initiative yet to the public?
No.
Okay.
And to my understanding, it's not affecting right now the Medicare members. It's more affecting those that are uninsured instead. Yeah.
Oh, I see.
Yeah. Any more questions?
Is there a charge for your consulting
No.
services?
No charge at all. No
I have a
charge.
girlfriend that retired a few months ago,
Mhm.
and her husband's still working. She's paying $900 a month medical. And I keep telling her to look into the Advantage plan. Can I have her call you?
Yeah, definitely. Please do. That's what I was sharing with them. Is that's the hardest thing about my job. I cannot just come up to people and ask, "Oh, is all your Medicare choices taken care of? You know, are you paying nothing for your plan?" I can't do that.
And there's no charge to the person that you talk to, like, I can give this to my mother,
No charge. Yeah.
you get paid by whoever.
I get paid by enrollment through the plans. Yeah. So it comes nothing from the members, nothing directly from them.
What about, oh, you know how she was asking about her girlfriend with the husband? Does that, sometimes because your husband is still working, can that affect what?
No,
you
if
can-
she's Medicare age, she can pick up her own medical. And it sounds like she's
She's not
paying it
covered.
on her own.
And he has no coverage,
Oh.
Medicare, medical coverage.
Is he
So she
65?
carries him.
Oh, she carries him.
Yeah.
Oh, see, now that may be a
I think
different,
that might be why.
because then if he's not Medicare age,
But he's still working, right?
he would lose her coverage.
He's Medicare age, he's getting Social Security,
Then he should pick it
but
up.
he's still working, but
Yeah, it doesn't matter.
She needs her help.
Yeah, it doesn't matter if you're working or not. It's a benefit you are entitled to.
Great help.
Good question,
Is
though.
it extra
Very good
business
question.
card from her?
Yeah, no, I got hers, good, we're good.
Do you guys have any questions?
I'm so good, I'm good.
It depends how much questions they have or kind of what steps we have to take. If we're applying for extra health benefits, I try to bring the application from Social Security so that way you guys don't have to make the trip on your own. And then we'll sit down, go through it all, and then that way the member just has to drop it in the mailbox. And then
Just a couple hours probably?
no, I would say not more than an hour actually.
Okay.
Yeah. And then I do come out and meet the member at their home because a lot of times they don't drive. Transportation is very difficult. So if they allow, I come to their home. If not, we meet at a public location, whichever they feel comfortable. Yeah.
you know, because I'm on Social Security, but I have a disability. And now, see, I don't turn 65 to January.
Right.
But they're gonna start me in September.
Oh, great.
This year, so I have, like I said, I had all this stuff come. I didn't know, I thought I had this. I said, and then my cousin told me, you better check because I don't think you really understand what you get covered and what you get. So I called the Social Security office, yes, and I told them, I don't understand all this Medicare.
But I don't understand it either.
Yeah, and I said, I hear people telling that. I said, my husband is like on a Kaiser. He's a Kaiser, I'm not.
Right.
I have a habit. So I said, but I hear people carrying insurance like AARP. I said, I get all this money. She told me, I cannot tell you nothing.
Yeah.
I said, I just trying to ask you, do I need a plan or what is, she said, I cannot help you with none of that. I said, I thought you worked with the Social Security. She said, yes, I do, but she said, I cannot tell you.
Yeah.
The medical part.
Yeah,
They cannot
she said-
steer you. Even myself, I can't steer you to one plan. That's why I ask these series of questions to kind of figure out which, because I know all the plans out there, and try and knock down the plan that would fit you best. Then offer you the one. And then if you say, well, what about the AARP one? Then I can, show you that one if you wanted to look at that one, like. I have all the benefits and plans. It's just trying to fit you with the right one that fits you. Yeah.
Is there an enrollment period, re-enrollment?
There's the annual enrollment period that's coming up October 15th to December 7th, which is those that just have Medicare only. That is the only time they can sign up in that 7-week period, which is the craziest because it's during the holidays.
What about those that have Part B?
Yes, that's during
You
that.
can make changes to your
Only
plan.
during that time, yeah. There's some special enrollment period, those that are aging in, they can enroll right before their birth month. Special enrollment period, also those that have Medicare and Medicaid, they can enroll anytime during the year. Those that just move into the state, they can enroll. So there's some special election periods, you just ask. But normally, annual enrollment is only October 15th to December 7th, which is a crazy time. Yes?
Just so I understand, so you actually represent all of these, or you're able to give your expertise on all of these healthcare programs that you have listed up there?
Correct.
HMSA, okay. So, is it all right to ask you, HMSA offers, I believe, 4 different Advantage, Medicare Advantage, Aqua Advantage programs.
3.
3, okay, ranging from 0 premium to $54.
Correct.
So, how is regular Joe Smith like me, and my husband, how are we able to tell the difference between the plans so that we can make an educated, intelligent decision?
Have you folks
If
looked?
the natural inclination is to assume that the $54 premium plan has more than the 0 plan.
Actually, yeah.
So what would your response be?
I would say sit down with me, and when we actually look, because they'll actually be side to side, all the plans, and you can see for yourself what they offer and what they don't offer. Because that's not,
So there is a specific difference between the
Correct,
three
there
plans
is.
then. Okay, next question, United Healthcare.
Mhm.
They have a Medicare Advantage plan
Mhm.
for seniors.
Yes.
And their take is that their plan is no different from HMSA.
That's incorrect.
It's incorrect.
Yeah.
So
It's
you
making a
have-
statement
you have
that
a
it-
comparison chart.
Well, you can make the comparison. So if I give you the AARP chart,
Yeah.
and then we're looking at the HMSA,
Right.
you can see apples to oranges.
Okay.
It's a difference. There's a difference. Every plan has a difference.
Okay, because I'm in the process of making a decision for my mom, because my mom is Medicare and Medicaid.
Okay.
So, presently she's on HMSA, and she's been on that for most of her life.
Mm-hmm.
But United Healthcare is offering a plan,
Correct.
at 0
Correct.
premium, and, when I said, what is the difference between your plan and HMSA, they said there's no difference.
I would definitely
So you're
want to.
saying there is a difference.
There is a difference, and I would definitely want to sit down with you because she has a special situation, Medicare, Medicaid. They have things differently and different benefits that are offered to them.
Well, I did sit down with United Healthcare, so
Mhm.
I can see some of the differences
Okay.
between them and HMSA.
Have you
Yeah.
have the HMSA pamphlet to look at all the benefits they
Yeah,
offer?
so I would have to actually bring that all up. So it's very overwhelming.
It is.
Labor intensive.
It is.
Because I'm just a regular person, and so they're gonna hit you up with all kinds of vocabulary.
Yes.
To confuse you.
Yes. You know, another thing too is the prescription is another thing key because every plan, Yeah, because every plan, covers different prescriptions, yeah, on
My
different
mom gets
categories.
assistance for prescriptions, so
Correct.
that's not a.
But
that's
it
not
does make a
issue.
difference when you make the Advantage plan, because her prescription may be covered under HMSA, but it may not be covered under United.
Oh, no, my mom gets prescription coverage through Social Security.
Yeah.
Because of her income.
No, but I understand what you're
Oh,
saying,
okay.
but the plans itself has a drug plan in there that she must take with that
Yes.
plan.
Yes.
So it does make a difference, even though she gets help, it does make a difference to the plan she selects if it covers that drug. Yeah. Yes.
What is Medicaid?
Medicaid is a state funded program that helps cover co-payments or co-insurance or prescriptions, premiums. It helps cover that for a member.
Is there income qualification?
For a
qualifier
state,
that?
yes. For Medicaid, there is, yes.
So lot of good information today, thank you very much.
You're welcome.
I'm hearing you talk about all the plans and, especially where you sign up for something, you become 65 and then you get inundated with all this mail. I know my mother-in-law is getting inundated with all this, does the homeowner have to be careful because some of it can be unnecessary things that they're signing up for with, like, she gets stuff like from AARP, like I get from AAA,
Yeah.
And I guess I'm hearing that you have to be vigilant and careful about
You do.
what they're selecting because they could be, like you said,
Yeah, there
selecting a lot of
is.
unnecessary things and not particularly maybe the best.
Right, or when
plan for
you're
them.
enrolling into a plan, you're not aware of what their formulary is like or what they cover. And that's something that you probably didn't even think of, But that's something you gotta think of from point A to point B.
So
not think of at all.
say I sent my mother-in-law to you and she's signed up for Kupaya junk stuff that she's currently paying a premium on probably for, for every little thing
Mhm.
for, is it possible, like, when you talk to them, to get them out of things that they're currently enrolled in
Yes,
and roll them over into something that's more
yes,
appropriate?
yes. Yes, definitely. We can help eliminate those premiums, help eliminate the unnecessary enrollments that they had applied for. Definitely, yeah. Yes, did you have a question?
First of all, I wanted business cards. And
Oh.
I was wondering, do you just consult on Oahu or do you have?
I do outer islands
Outer
as well.
Islands, okay, 'cause I work in Kona, and I work for a private nonprofit, Individual Collective Children's Center.
Oh.
And so we run kupuna groups and Ohana caregivers groups, so, it would be nice to have you come and speak to them as well, so.
Definitely.
Yeah, and then I
Okay,
have
I think
another.
I'm going there next month.
You are?
Yeah.
Okay, I'll mention that to one of the project leaders.
Okay.
And the other thing was, for myself, my husband will be turning 64. He's retired 5 years from the federal government and currently carries me on his HSA.
Mhm.
So, looking at what you just presented, I'm sorry that I walked in late. Once I turn 60, or when he makes 65, he will choose Medicare. Does he need to choose the plan?
It depends, because federal governments, they offer different retirement benefits. So some, they choose the Medicare, and then they also have their federal plan.
Right.
But then, only for federal, it's tricky, only for federal employees, they can sign up for an Advantage plan, giving them double coverage. But they cannot sign in a plan that has prescription drugs, because they have a drug
We have it
plan.
already,
Yes,
yeah.
yes.
Okay.
So it's a tricky
Yeah,
thing,
'cause,
but
he doesn't get free medical like maybe some of the state workers do.
Yes.
We still pay a portion, it's nominal compared to what other, like for our
Yeah.
private agency, retirees will have to pay once they leave the agency.
yeah. So what people do in those cases is they keep their retirement plan, because it is affordable, but then they'll also pick up the Advantage plan to have double protection and double coverage. Because their Medicare Advantage plan would be primary, the federal would cover the balance. So whatever co-pays and co-shares they would have, the retirement plan would cover it.
You would have utilization for just taking a part of that?
No, he wouldn't, because he has a credible drug coverage through his employer. So that's the only thing he would opt out of would be the drug coverage, but his A and B he would get.
Oh, then he would still have to
Yes.
take that. Oh, okay.
Yeah. Yeah.
I
So
see.
it's
Yeah,
very
that's okay.
tricky, it's very time consuming. That's why we have to go through 6 months of training, and every year we gotta go through new accreditations, So we do have to keep updated, yes. Yeah.
What kind of, like to better help our kupuna when they do have like meetings with you, what type of documents would you need for them to supply or bring when
Just
upon meeting?
their medical cards. That
Really?
helps a lot. Cause I, like I said, I'm contracted with all the plans, so
Right.
I know what plans and what they offer.
So just their medical card?
Yeah, just their medical cards. Yeah. If they have a private insurance, company or retirement benefit, maybe having their summary of benefits through that would help me kind of, because every retirement offers different things. So I don't know, like HMSA has like millions of plans.
Are you able to access like a database and pull them up to see what they're carrying and all of that?
No.
Yeah.
I know.
Too easy.
That would be too easy.
That makes too much sense.
Yeah.
True.
But you can tell by them having their medical card or
Yes.
summary of benefits.
Yes, definitely. Any more questions? Thank you, ladies. Well, with the list of people you had made, please do share your information with them. And again, my time and resources is all free.
I guess that, like, for me, I have my parents who are very, I want to say that they had jobs that offered, great medical coverage after their retirement. But I have my mother-in-law who, not so fortunate,
Right.
is doing the Medicare and, and all of that route. Are you pretty successful with helping those type of clients in their
Yeah, definitely.
situations?
I mean, I can pull up my contact list, and I still keep in contact with all my clients. I have over about, I want to say 700. Just for myself.
Because no matter what, if you're not one of those lucky people that had one of these great retirement plans with great health care, you're probably in the other bucket of this where you're paying that $100 premium for Medicaid B or for Medicare B, but not knowing what else you could get for free in addition with that.
Yeah, there's a lot of people. And that's one of the toughest things about our job, is not being able to share it. We have to find a group of people, a group of seniors, a group of places that will allow us to talk. And then sometimes, they think they have it all and they don't even want to listen. So sometimes they're stubborn. So, it's just getting in front of them, giving out the information, and then just letting them make their own decision.
So there's sometimes that you might even meet with somebody and you're like, oh well, you know what, you're right, you got the best thing
Yeah,
going on.
Definitely. Yeah. This island is only so small, so I would not want to tarnish my name. That's like the biggest thing I'm afraid of. Making sure I do the right thing for each person. Yeah. Thank you, Cole.
This is so helpful. Thank you.
You're welcome.
So call you to make an appointment?
Yes, please call me. Next week I'm free. Give me a call. I come out to you.
Okay.
Thank you.